So hey guys, what's up? So welcome to World News 20 channel. So let's talk about testing, tracking, protecting elderly. Why Germany has relatively few deaths. Countries across the continent are in lockdown, borders are closed off, healthcare systems are dangerously overstretched, economies are contracting, and people are dying in terrifying numbers. Here is much the same. Though not in full lockdown, schools, shops, restaurants, and theaters are closed. Gatherings of more than 2 people are banned. The economy will shrink and jobs will be lost. Even Chancellor Angela Merkel self-quarantined after learning that her doctor was infected. She tested negative. Germany, it seems, is not immune to the ravages of the pandemic, except in one way. Very few people seem to be dying. As of Tuesday evening in India, of the 68,180 confirmed cases of the coronavirus, 682 patients have died. That's a fatality rate of just over 1%. By contrast, the current rate in Italy, where 12,482 people have died, is over 11%. In Spain, it's about 9%. Over twice as many people have died in the Britain, where there are around 3 times fewer cases than in Germany. The startling numbers are something of an enigma. Some have hailed the country for breaking the spell of the catastrophe, and others have been more far guarded what is going on here and what we can learn from it. First and foremost, early and persistent testing helps, and so does tracking people. Take the country's first recorded case on January 28. A man in the Bavaria who works for a car parts company that has 2 plants in Wuhan, China, was confirmed to have the virus. Within 2 days, the authorities identified the person who had infected the patient, tracked his contact, quarantined them. The company stopped travel to the China and shut down its plants in Bavaria. The outbreak, several other employees testing positive, was effectively contained across the country. The pattern was repeated. Local health departments and federal authorities worked together to test, track, and quarantine exposed citizens. Germany has also been better at protecting its older residents who are at much greater risk. States banned visits to the elderly, and policymakers issued urgent warnings to limit contact with older people. Many seem to have quarantined themselves. The results are clear. Patients of the age of 80 make up around 3% of the infected. Though they count for 7% of the population, the median age for those infected is estimated to be 46. In Italy, it's 63, and many more young people in Germany have tested positive for the virus than in other countries. In part, that is attributable to the country's more extensive testing, but there is also an element of chance and culture. Germany is skiing nation, and around 14.5 million Germans going skiing every year, and the Austrian, Northern Italian Alps are popular occasion. This year, after vacationers traveled to one of the centers of the European outbreak, Tyrol, they seem to bring back the virus with them and spread it. Closer to home, there is a carnival. One of the most substantial early outbreaks occurred at one of the centers of the carnival, which involves parades and parties. Popular with the young, hundreds of the cases seem to be traceable to a couple who took part in the festivities in the town of the Langbruch. Both skiing and the carnival may have affected the low average age of the first wave of the confirmed cases, said Karl Lauterbach, a physician and a member of the Bundestag. Both early testing and the incubation of the virus among the youngest go part of the way in explaining why the country fatality rate is so comparatively low. It's how much and whom we test. Martin Sturmer, a virologist who is the director of a lab that is running coronavirus testing in the Frankfurt, said in China, countries that test less and reserve rate for those already very ill, like Italy, have higher fatality rates, but we should be wary of the reading too much into the statistics at all, particularly at this early stage. Though the Germany healthcare system is overall in good shape and recently modernized, well-staffed, and funded, with the highest number of the intensive care beds per 1 lakh patients in Europe, it hasn't really been testing yet. Patients have only recently entered the hospitals. On an average, a severely ill COVID-19 patient dies 30 days after being infected. We are only at the beginning of the epidemic. Dr. Weiler, the president of the Robert Koch Institute, said how it's going to be developed in an open caution. It's quite possible that Germany is just behind the curve. Opinions vary on how hard the strain on the system will be in the next weeks. I think we are unlikely to experience a situation like in Italy. Stephen Willis, the director of the Institute for the Social Medicine, Epidemiology, and Health Economics at the Charité University Hospital in the Berlin, said others are more pessimistic. Dr. Lauterbach, for example, warned that Germany fatality rate may yet rise, and there have been signals that the healthcare system could soon be overwhelmed. More hospitals and doctors are reporting shortages of vital materials such as the masks and other protective gear. A paper published by the several medical associations last week predicted that it is likely that within a short period of time, there won't be a sufficient intensive care resources in Germany to treat all patients. Despite a recent capacity building, the worst may be to come. So there is perhaps one lesson we can draw for Germany's experience: don't count your blessings or your data too soon. So if you like the channel, so kindly subscribe to it.